Okay, we're very lucky. We have Dr. Elizabeth Ridley with us. She's the medical director for the Center for Functional Medicine, phenomenal clinician, and very well respected in the functional medicine community. And thank you for joining us today.
Well, this is wonderful. Thank you for inviting me to talk about functional medicine. This will be fun.
If you can tell us your journey. When did you decide to go from conventional medicine and kind of veer into functional medicine? And how did you end up running the Center for Functional Medicine? And
Sure. So we started way back with, I have a degree in nutrition. So I was at Cornell, and we're talking a long time ago. And then from there, I went on to the Tufts School of Friedman School of Nutrition, and I have a master's. So I was doing nutrition before I went into medicine. Once I went into medicine, I kind of incorporated nutrition within my framework of dealing with patients, but we know what standard internal medicine is like, and there's a lot of time crunch. So fast forward years later, I actually encountered a patient who had had a functional medicine experience. And this was an eye-opener for me because the patient was not getting better with my tools that I knew and my testing that I knew. I was in an academic institution at the time. And they came back and they had said, you know what, I'm better after going through the functional medicine experience. And I just said, okay, I need to find out what this is and dive into it. And that's my first foray into functional medicine, and really found that I didn't have all the tools. I didn't have everything that I thought I needed to take care of patients at a deeper level. And functional medicine has been wonderful. We always talk about, you dive deeper, but the toolbox that you get is unbelievable. So from there, I was at Dartmouth at the time, and I started to incorporate functional medicine as much as you can in an academic institution that is not, your patient visits. They were pretty lenient at that time. They're like 20 minutes for a follow-up and 40 for a new patient. But then I had been running a clinic at Dartmouth. The clinic is in the community of Lyme, New Hampshire. Ironically, people think that we do all Lyme disease, and we had to tell them, no, we are Lyme in not Lyme, New Hampshire. So anyway, so from running this center for 10 years and doing residents and teaching and medical students and giving lectures, and then finally incorporating functional medicine into my world, I just could not go back to just doing regular medicine at that time. And a lot of larger institutions and academic institutions are not geared or ready to incorporate this type of medicine into their normal processes and clinical flow. So fast forward, this Center for Functional Medicine started in 2014. Thank you, Mark Hyman and Patrick Hanaway, and also many of the people in IFM really spearheaded this whole center. They were looking for a medical director, and that was back in 2016. And I remember looking at this thinking, it's academic, it's functional medicine, it's teaching, it's research, and seeing patients. And I said, it's a perfect fit. I just looked at my husband and I said, I have to do this. I have to come forward and help the community of functional medicine bring this to the next level. And 2017 came here. I'm ending my 5th year. And it's been quite an exciting journey, but it's been quite a journey, especially in a very large academic institution. This is the Cleveland Clinic, and they're renowned for so many different things. So for us to come in here, the first question is, who are you? What do you do? So I think that was the biggest part of my journey, is to collaborate with all the different institutes, which are centers within the Cleveland Clinic, and explain what is it that we do in functional medicine and how can we help your patients. And I've always used the terminology of adjunctive, because I never wanted them to feel that we were going to take over their care or we're going to displace anyone. Our whole goal was to come in and I'm just going to make your patients that much better. And especially in the world we know in academic medicine with ACOs and knowing that you have metrics that you have to fit, I always felt that everything we are doing is only going to enhance the hospital's approach with patients and also the ACO approach and that cost effectiveness. So that's how I started. Yeah.
And how's it been since you've been there? What has the response been? What has the collaboration been like?
Yeah, it's been really, in the beginning, it was a little bit of, how can you help me? And then when I would go into ways that we can help them, this happened one time with the chair of nephrology. He didn't quite understand, okay, so now what are you doing again? So I try to come from the standpoint, I haven't been a nutritionist. I kind of come with nutrition first, working at, looking at the patient, all the lifestyle factors and how we can improve chronic disease within that framework. And after I told him this whole story and how actually renal function improves, he just looked and went, okay, I get it now. Like we should all be doing that, but we don't have the time. We don't have the time or the expertise and to be able to hone in exactly on what that patient needs. So the collaboration has started with many different institutes. So we've worked with the Digestive Center. We've just finished a wonderful, it's called the Buena Vida Shared Medical Appointments with the Metabolic Institute and Endocrinology, where patients that have chronic diseases, and they mostly with weight management, and specifically for an underserved population, which is the Hispanic population, we just finished this 10-week induction phase, and then they're going to continue with a monthly meeting with the patients for a year. And it'll be great to see the outcome of that. But they saw the value of our lifestyle nutrition approach, and especially with our shared medical appointments, which is an intensive 10-week program and the patients meet weekly. So that part has been a lot of fun. Other institutes we've worked with neurology, we've worked with anesthesiology in terms of developing a pain shared medical appointment for patients. We are always involved, right? Because right now we are in something called 4C, which is their community, basically medicine component of primary care. So we're involved more with family medicine, internal medicine, pediatrics, and also explaining to kind of an internist. This once again goes back to adjunctive care, that we can help your patients. We can help them lose weight. We can help them change diets. Or at a more extreme level, we work with a lot of the neurologists with POTS syndromes, and we've been having great results with that. The studies that were started prior to me coming on, there were a couple of randomized controlled trials. One of them was the diabetes. So we've worked intimately with the Endocrine Diabetes Institute, where we were working with patients. In addition, they would randomize to either endocrine or to us. And it's been fascinating to see. If you had told me prior to doing this study that I could get patients off of insulin and lose weight and actually take the supplements, I was shocked, but it actually did happen. It was a wonderful, wonderful outcome to see this, because once again, it's adjunctive and we're not taking over the patient's care from the endocrinologist. We work a lot with thyroids, that's once again within the endocrinology department. And even surgery. We are looking at hopefully doing a study that's going to look at wound care and trying to minimize the side effects of, in particular, breast implants for medical reasons or whatever. There's a couple of reasons why, but that's a study that we're looking at coming forward. So I think one of the main missions of coming here is to prove the model of functional medicine works. And it's kind of hard to say, okay, functional medicine is not just one pill. It's not one supplement. It's such a comprehensive approach with all the lifestyle factors that it's become a little bit more difficult to explain to other physicians that what we do, the word functional medicine may not be in an actual study, but you could say lifestyle. You could say the recent VITAL study that came out with vitamin D and omegas reducing autoimmune disorders. I looked at that and I said, we incorporate that type of data, evidence-based, into our practice, into our real time with patients. And so this has been a lot of the education that we've had to do with just basic primary care physicians so that they understand what we're doing is evidence-based and they can understand the model. Because sometimes they think functional means the function, like you're functioning, the body's functioning on a physical level and not necessarily the functionality of all the different clinical imbalances that we know within functional medicine.
Well, that's fantastic. I know I teach, I'm part of the faculty that teaches at Loma Linda School of Medicine. We have a 2-week functional medicine program. So we have to deal with, or have issues with some people that are, really concerned about functional medicine being at a medical university campus. And, they think it's just about selling supplements. And
yes,
it's like,
yes,
all you guys do is just sell supplements. And this is like, why do we have this terrible thing in our university? And it's like, no, wait.
stop. Let me tell you what I actually do.
Right.
And I think that has been the biggest consistent challenge, but constantly I was always getting on somebody's meeting, like their staff meeting. Let me present to you. Let me present to you. Even present you to the board of governors. Let me tell you what we do. As a matter of fact, when I was interviewing, one of the heads of executive leadership said, I don't know what you do, but all I can say is that you have a 2,000 patient wait list here and we can't ignore it. And that's like prior to coming in.
Nice.
And I think that sort of prompted a lot of getting our SMAs going, because that could really take a lot of patients in the very beginning, anywhere from 10 to 15 patients, you can do in a shared medical. And to fit those into a normal one-on-one practice, we just don't have the staffing. But fast forward, I've been able to, thank goodness, we're up to like 9 providers. We have nurse practitioners, APPs, and physicians that are in our center. And we have 4 RDs, nutritionists, and we have 3 health coaches, and then we have a behavioral health specialist with approval for another position just like a week ago. So we've been able to whittle that down to 400 patients and on our wait list. I think the thing to think about is that we are insurance-based, and there's not that many insurance-based practices in an academic institution. We probably were the first, and little by little, there have been more institutions around. And I think that sort of drives a lot of our wait list, because patients, they can't afford necessarily, cash for ongoing care.
Right.
And I've been following patients now for 5 years. Initially, we were just supposed to be only a consultative. I get you better, and then I send you off. Like you don't need to see me anymore. But there are a lot of patients like with Hashimoto's and certain other diagnoses that they want to continue following us. And as a matter of fact, I even have had the blessing of endocrinology specialists in thyroid who basically said, "Can you take care of this patient for me in terms of the thyroid?" She goes she wants to see you. And I said, absolutely. Having done that for years as an internal medicine physician, I felt very comfortable, and then layering on the functional medicine component. So, yeah.
You guys are doing breakthrough work. You're changing the profession, the specialty within healthcare. It's amazing. Yeah. So thank you for doing that.
No.
Now, most functional medicine practitioners in a private clinic. They're not in a medical center treating, and there's lots of differences between what can be done in a private setting and the medical center. So, first question I want to ask you, just clinically, is what we know that functional medicine model requires a compliant patient, right? They have to have some degree of compliance. They want to do things. They want to have lifestyle change, behavior change. Some of that is required for the model to work, right? It passes.
Absolutely, yeah.
Where does polypharmacy come in? What about the point where you have some patients that are on so many medications, and is there a point you see with your experience where it's just too much to really incorporate the model? Now, I understand with weight loss, if they have diabetes, if they just lose some weight, a lot of things can change. What if it's not a weight loss issue? What if it's like a person where that lifestyle factor isn't weight loss, and they're on polypharmacy? Maybe let's say an underweight person with lots of medications, autoimmune disease, and now they're walking in. Is there a point you see with your background where that becomes an issue to fit the model, or do you feel like there's always something you can do?
Always something I can do. And you know what? You are describing our typical patient. We're in a huge tertiary care hospital. And I don't want to say that a lot of specialists basically say, I don't know what to do with you. Go to functional medicine. They'll help you. Right. And it could even be basic, getting the patient to sleep. But really nutrition, a lot of people don't know nutrition. We know physicians are not taught, our healthcare providers are really taught about what patients should be eating. And and patients actually come in specifically saying, I would like to get off of this, and this medication. And we start from the very basics. We start with healing the gut and looking at the nutritional insufficiencies and bringing them, once again, hopefully given nutrition as the number one with supplements if needed. And then little by little, we would work with the specialist, or I would say to the patient, you need to talk to your endocrinologist or your cardiologist if you want to shift any of your medication. Or I've had really intense ketogenic shared medical appointments with some patients that are on a lot of medication. And we send notices to all of their physicians prior to starting this, that they need, that number one, I want you to know and be aware that the patient's in this program. Do you approve of it? And that you'll help manage some of the medication. I can do some of it, but it's their patient. And I want them to feel comfortable that if there's a change happening for their patient, that they're involved with this. And the patients know that. And we've even had patients like with significant cancer coming in wanting to do specialized dieting while they're getting chemo, which would just augment their chemotherapy, or after chemo, all the nutritional insufficiencies that have occurred. So we don't necessarily take people off of medications. I will suggest adjusting, especially as you were saying, if they have weight loss, their blood pressure is going to come down. And we have shown this over and over and over. So they need to come off of their diuretic. They need to come off of some of the other medications that they've been on because of weight. But some of the more significant, like with the diabetes, definitely we have them come off of a lot of medication. Like I said, that one patient with the trial, he was coming off of insulin. And then we have a multiple of patients with autoimmune disorders. We don't step on toes. That's really important in an academic institution. But if the patient is doing phenomenal, then a lot of times even the specialist goes, I'm not sure you need this anymore. And then we start doing weaning off of some medications and then see how they do. So I think it's such a multifaceted approach, but ironically, ideally patients, not even ideally, a lot of patients come in with like 10 plus medications on board. And the hard thing is trying to be very pointed and where you're going to get more dynamic change in the patient's health with what supplements and what approach, because most of our patients are fairly motivated. Though it's interesting, you'd appreciate this. In the beginning, when it was a 2,000 patient wait list, they were so motivated because these are people that wanted functional medicine. Now, all of a sudden, we have patients that are referred by, let's say, a pain specialist or their neurologist. And I said, do you know about functional medicine and how we can help you? Nope, they just told me to come and I'm here. And so all of a sudden, it's like someone who doesn't know, and their motivation is to get better, but they may not be motivated, quote unquote, to be compliant with what we're asking them. But we use the Living Matrix intake form, and there's a whole readiness component assessment. And we do look at that because that can tell me, okay, how much are they going to move in terms of their diet, or how much support do they have at home, that I know that what we're going to ask of them, they're going to be able to do. And sometimes we have to be realistic in what we're asking patients. And that's the first question I ask them is, tell me how much you want to do or you're able to do, or areas that I can help you the most. And that's sort of like when you talk about the time limitation we have, I really go into using the Living Matrix, find out about the patient, use that for my charting. So I have all this information. So when I walk into the room, I have an idea, but a lot of times it's a lot of information. And the first question I'll ask them is, in the time that I have with you today, how can I help you? What are the top 3 things that you would like me to accomplish? Because I know I've got 1,000 things in the back of my head. I want to find out all the different clinical imbalances and try to balance it. But that's not where they're thinking. They're saying, maybe they just want to improve their fatigue. I would like to lose some weight, and I want to know what supplements I should be taking or not taking. Or one person walked in and they just I want to have optimal health. Well, what does that mean? It's different to each person. So that's what I try to sit back and really listen to what the patient is telling me they want, because I can come up with my own agenda, and then they'll walk out very unhappy and very unsatisfied. So I think that's my first starting point with every patient. And we all know this from medicine, but the whole kind of quote, listen to the patient, they'll tell you what's wrong.
Right.
That has been my modus operandi ever since I started medicine. And it's never failed me, actually.
Right.
And to this date, I still use that.
So Liz, do you think your practice would be different if you were in a private practice versus at the center? And how?
Yes. I probably won't be as efficient. Isn't that interesting? Because I'm forced to be efficient. Mm-hmm. I would spend more time. I would spend a lot more time. And I love working with patients. That's like the joy of my job. And I think I would just spend a little bit more time, though we do get an hour with every new patient. And if I've done my prep work, I can pretty much get a lot done. The only thing I would do different, and this is sort of interesting, coming from this center versus what I had been doing before. I also have nutritionists that can spend a half an hour to an hour with the patient. I have a behavioral health specialist. I have a health coach who can be checking in. I used to do all of that. I'm training in mind-body medicine. I'm training in nutrition, and now, functional medicine as a physician. I used to do it all. And I'm realizing if I were in private practice, I might do more of the nutrition, mind-body medicine, meditation, help guiding them. Even though I give them the information, I would probably spend more time in the actual visit going through that. And I don't have to do that. So I can focus a lot on what it is I'm trying to achieve for the chronic disease component and dive in deeper, and less on the other component, if that makes sense.
Yeah. I mean, we have a group of people that are at the Krause Institute that are physicians that are in medical centers, and they love functional medicine, and they've, found out that functional medicine works for them and their family members. They're not ready to jump in to functional medicine, and they're like struggling. And some of them have been struggling for years, and they don't know what to do. And taking that leap of maybe going into just private practice is a big leap, because it's a whole different business model, a different world, and different source of security that comes in with that. What kind of advice would you give that group of healthcare professionals?
And how to incorporate it into their
what would you recommend to them if they're, hey, I don't know what to do. I'm scared. I want to do functional medicine. I don't know if the community medical center would.
What I would do first, because once again, it goes back to having education. I would give lectures to the staff and community, lectures for patients. I would have them start writing, if they could do any kind of writing, where I know we have places where I could write things and everyone has access to it. I would then start incorporating it with the patient. What I did when I was not here, I would say, would you like to think about this in a different way? I'm like, what do you mean? So, well, let me explain to you about what I'm doing, which is functional medicine. And I said, let's just start with, let's say, GERD. We know that certain things can really help this. And let me go through this with you. Would you like to try this approach first before deciding to go on medication? So always getting the patient's buy-in, the patient wanting to do it, and like a shared decision-making, have the patient be part of that decision-making. And 9 out of 10 times, the patient said, yeah, I don't want to go on medication. I'll absolutely. And then I would use the toolkits, and I would pull out certain diets and whatnot, become very familiar with the diets, because to me, in the different meal plans, that's kind of the critical cornerstone of what you need to do with patients, and become very familiar with like mind-body medicine techniques, because we know that it helps so much in every category of any disease. So the lifestyle components, I think, are critical. But a lot of even functional medicine physicians or practitioners or anyone may not be totally familiar with nutrition. And I think I would focus more time and energy and also education on learning more about nutrition, so that you can help your patients from a nutritional perspective.
Right. And by nutritional perspective, do you mean diet, or do you mean nutraceutical supplements?
Yeah, that's a good question. Both. But I would start with the dietary. What are the detox foods that actually help with detox, and why? Like, really understand phase 1, phase 2, and what are the foods that provide the nutrients that you can support the patient. And then the next step would be, okay, now tell me what supplements would support phase 1, phase 2, and all the intermediates that are going to help the patient, because the patient could actually get sicker before getting better if you don't do it the right way.
Right.
And I think a lot of, I do this even with my residents and medical students. I said, okay, you learned about phase 1, phase 2, didn't you? About all those medications. You learned about those P450 enzymes, didn't you? Well, let's dig deeper and let's use it. And just even like the use of biochemistry. We learn it all, like in all of our training, but do we use it? So then I challenged them again. I said, okay, let's think about the on the web, the energy and the mitochondria. Okay, so what nutrients are used in the electron transport chain? Have you ever even remember that one? And so it's been really fun to teach people who heard it, they know it, but they're like, oh, I can actually apply things in my practice, in my day-to-day to help a patient. And it's not over the top, and it's not, I don't think it's difficult. I think it's just another tool. It's fun. It's actually fun to be able to do this.
You know, it was interesting as an educator and someone who's been functional medicine for a long time. When I see experienced functional medicine practitioners, they're really focused on diet and lifestyle, and they work on what they're eating, how they're sleeping, how they're getting movement, and really focus on those fundamental things. And when you see people that are not very good at functional medicine and new, they're just ordering way too many labs and just trying to throw supplements all at it, and hopefully like the right supplement is going to fix it. And for those physicians that are trying to get to functional medicine and they work in a medical center, I mean, focus on personalized lifestyle and getting sleep and diet, and not really having to do every single lab test and every single trendy marker.
Interesting. Our newer physicians do exactly what you said with the newer functional medicine. They will dive in, and I call it, it's like, you know, a child in a candy shop. They'll just order every test.
Yeah.
And I think the only good thing is, because a lot of patients are on a budget, we have to sit back and go, all right, where am I going to get the most information from? What am I going to order from this patient? And if I have to make a decision between stool testing versus a full nutritional eval, I have to really look at the patient and what's there. In my mind, if I'm already assessing and getting a gestalt of what's wrong with them, I would have to make a decision. And some patients, they can't even afford that. So then you're back to, okay, let me pull back even further. And as you said, do all of the lifestyle, but I know they probably have SIBO, or I know that they have dysbiosis. Let me dive into it and actually treat up front. A lot of times I don't do that because I don't want to commit a patient also to herbs and certain things that I don't think that they need. And I'd rather be more judicious in what I'm recommending, and also highlighting certain regular blood testing that we do here. We have sets of things, and so it's so easy just to order too many. But once again, I kind of hone in and go, okay, do I need that? Is it important? Why do I need it? It's kind of, and it's part of this value-based medicine, which is really being brought to light, especially being here at the Cleveland Clinic.
Yeah, I mean, even if people are in a medical center and they don't have access to all the trendiest functional medicine tests, routine blood test says so much, and medical history says so much. You can really implement these things, and then you don't have to worry about jumping into this model. And I don't know where that comes from. I think maybe it's the conferences. There's so many exhibitors that are labs and nutraceutical companies, and I think they just think that's what it's about.
Yeah, and I'll tell you, patients are overwhelmed.
Yeah,
they get confused, and then if, let's say, they do 5 different tests. And are you going to go over all of them at your follow-up visit, where we know we have 30 minutes, and the patient wants to know detail? But in retrospect, some patients want to know the nitty-gritty, and some are just like, tell me what to do. You know, it's similar to medicine. If you're given medication, like, tell me why versus I don't even know. I don't want to know. Just tell me what I need to do.
Right.
And I think we've learned to be also kind to our other providers at the center, because if a patient can't come see me and they go see another provider and I've ordered 5 tests, the provider is not overly excited about spending 30 minutes and trying to go over everything. And you can't go over everything. So we've become very pointed. And it's interesting you said that, because if I were, or anyone else is in private practice, it's so easy to order so many different tests. Yeah. And in actuality, okay, so this is a great example. We do this shared medical appointment called FFL, Functioning for Life. It's a 10-week program. They see the provider for 4 sessions, and then they see the dietitian the other sessions. And we order just a very pointed, few testing, things like omega, vitamin D, maybe C-reactive protein, lipids, some glucose or A1C, insulin, depending on which our shared medical group is, and then very small amount of supplements, and the patients get phenomenally better.
Nice.
Because the basis of it is lifestyle medicine. It's focusing on sleep, stress, mindset, focusing on nutrition, eating healthy. Because we know when you work with patients, the American diet is, we call it the SAD diet, right? It really is not a very healthy overall diet. And we have to meet the patient where they're at. And so some of them go full force. Yes, I'm ready. I feel so bad. And literally within 2 weeks, they come back and they're feeling better.
Right.
And I love the shared appointment only because it's more intense, right? You see them so they're being touch points every week, where sometimes in private practice, you see them once, you might see them 6 weeks later, maybe 3 months later.
Yeah, it can vary. So, you're in a position where you have very limited time in a medical center with an appointment. And even practitioners in private practice, they're always struggling with how much time it takes to get through an appointment. In your situation, there's just no room, and you have to get the job done. Private practices, there's more leeway, but you really become a master at getting what you need done with your patient. And I can tell you that because if you read your reviews you have with patients, let me read a couple of them. Dr. Bradley is incredible, the very best doctor, thoughtful, incredibly knowledgeable and helpful. There's one person, she's the first doctor to listen to me and was able to understand and apply real solutions to my problem. As always, a phenomenal visit with Dr. Bradley. Dr. Bradley's efficient and knowledgeable. In a 30-minute visit, she was focused, and I left with information to improve my health with lifestyle supplements. She recommended untested. I will be completing information about my health, and it's all like that. Like there's nothing. They're all positive like that.
That is so sweet. I try not to look at those.
You should look at them. They're all really good, and they're all like 5 stars, and you rarely see that with people. So that's a skill, and that's a real skill. That's actually a really powerful skill, because you can know all these biochemical pathways and all these nutraceuticals, and then if you can't connect with the patient and you can't get that information across, then it doesn't work. And if it's taking you hours and hours to get your point across to a patient, that doesn't work either, because you run behind, you burn out, and so forth. So what are the attributes, what are the skills, what are the tips you can give all of us, which is how to make you efficient with that?
It's interesting. I do a lot of education, but I start with, and believe it or not, I use the functional medicine tree that we have with IFM, and I'll pull up their living matrix and I'll show, okay, or even if they did a paper one, you have to know where things fit into the matrix, right? That's important as I think a practitioner. But let's say autoimmune, the immune and defense repair are like the big thing, and hormones are their big clinical imbalances. I'll highlight that on the actual functional medicine tree. And then especially someone who's very naive to functional medicine. And then I'll dive in and explain our approach and how we're going to work through this. And there's another slide that I've seen that I love, which has like inflammation in the center. And I always talk about like the spokes of a wheel that come off of it. All of our chronic diseases are around it, but the core is inflammation. And that's going to be our approach for you. And this is how we're going to go about it. So I think when you bring it down to very basic terminology, and I try not to use too many words that they don't understand, because it's hard enough for a regular practitioner in functional medicine to figure it all out themselves. Never mind trying to explain it to a patient where we know all the detail. So that's like my first approach, but really backing up is listening to why they're there, and a lot of times, and validating. I think that's the big thing. A lot of times they will go to a physician, and the primary care doctor, whomever they will see, or they just look and go, I've heard this so many times, like, I don't know what to do with you. I'm not sure I can help you. I don't know what to do that will help you. And all of a sudden I look at them and go, like, the lights start going off inside, and I'm thinking, oh my goodness, there's so much we can do. I can definitely help you. And this is what we're going to do. And seriously, they walk out of there going, oh my God, this is the first time I've been heard. Because what I'm telling someone all they'll say to me is, well, let me just give you this pain pill. That's going to help your pain. And I back up and go, no, 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 your inflammation is from this, this, and this. And we have to do these things. They're going to help you. We don't have to necessarily just give you a pill. But I do also say to patients, you have to put the work in. Like you had said that earlier in terms of having someone committed. And I said, are you ready for this? And I just have them sit back and wait, because some of them aren't ready at that time because they don't really know what's expected of them. And I said, if you're not ready right now, let's say, to dive into the nutritional part, pick a time when you are. This is your journey. It has nothing to do with me saying, okay, you're going to start this on this day and this next week. It's your journey. And the whole idea is for you to try to figure out how you're going to make your health better.
Right. There's a couple interesting things I want to point out, and you may not even noticed it, but first of all, you use very powerful educational tools that get the message across. So that's a really important aspect for people to know about. So the functional medicine tree, spokes, and things going out, so they can clearly see it, so try to understand it, making an effort not to make things too complicated. Some people feel insecure as practitioners, and they feel if they talk about it, the details of it, that it makes them feel smarter and they have more compliance with that.
Or you feel like you're simplifying it, or you're right if you do exactly the basic approach. Yeah.
Right. Yeah. And also, when you were talking and you were talking about, are you ready for this? This is going to take a lot of work. Your whole body language changed when you did it, and your eye contact, you stopped blinking, and you looked. It was obviously you're staring at the patient, and you had that impact, right? And I always say, skilled clinicians have like a Jedi mind power trick, because you could have like a new practitioner go to a patient and say, hey, don't eat gluten, and they're like, whatever. And then like a skilled practitioner go in and say, listen, you really can't do this, and everything changes. So there's that set of tone that comes from confidence, that comes from the ability to deliver a message, and comes from your body language. Like when you were making those impacts, like when you're ready to come back, like even your body tone was very serious. So what do you think is just because you have a strong belief system, you connect with them, you talk to them as your friend, peer, what's going through
that, but also experience. Like I've seen, and I will say to patients, I have seen this. Oh, and I have seen this. They're like, you're kidding me. I'm like, no. I know exactly what's going on.
Right.
And sometimes, it's interesting you said that, because I had a patient, I just sat back and listened, and she had a lot of medical issues. When you look at that MSQ and you see 154, this person has a lot of history. And I just stopped for a second and I looked at her and I said, tell me about the trauma in your life, because that to me, I think is the driving force. Oh my goodness. That just opened up. That was it. And she just said, oh my goodness, thank you. Thank you for asking me. I think this is kind of another point that I feel a lot, even when I was doing normal medicine. We never really dove into that as much, where we wouldn't ask the ACE score, early childhood, adverse events. We may ask domestic abuse or some kind of questions of that, like when you first meet someone, but you don't dive into a lot of their past and their whole history. And that's why I tell the patients that I said, Living Matrix, this is your living medical record. Like, this is your whole life. Right. I have everything here. It's wonderful. And I think all of a sudden they're thinking, wow, it's the first time someone's really asked and found out what happened to me when I was a child, what happened to me through all the major stages of my life. And, the timeline on the Living Matrix, I love it, because I'll pull it up and I'll be like, okay, this is where you're born. This is where we are now. You didn't put anything for the first 42 years. And I know an awful lot happened. So let's back up and go through that. And all of a sudden they're coming up with things they totally forgot about, that to me are huge triggers, or huge, I explain that to them, or mediators, or things that have been like that low level. We talk about inflammation, for example, and then something just wham hits you. And now that's why we're here. And I think it's important for patients to understand that it's not their fault that things are happening, that there are things that happen for a reason. We always talk about this with functional medicine, the patient's story, have the patient, talk to the patient. And I think that once again, the visualization helps patients see that. And I think that's important, especially with the time limitation that we have.
And then with time limitations, the fact you're using questionnaire forms and you're using all this paperwork to document things so you can see everything quickly, because what you can see on some of these forms, documents, questionnaires would take forever to get out of a history.
It really does.
But you can quickly screen it because you know what the questions are for certain portions, and you can start to see your patterns.
Absolutely, absolutely.
So I think having diagrams, having these questionnaire forms, having that information there is making you become really, really efficient in that short period of time you have.
That's exactly it. And then we're in Epic, so Epic EMR.
Right.
This is extremely, and it's funny, when we first went to Epic when I was at Dartmouth, it took an hour more per day in my life just to document for the patient. So fast forward, we have smart sets, we have templated notes, we have templated initial note, follow-up notes. I've templated, and we developed this over the last 5 years, templated every note for every shared medical appointment. If I didn't have that, that would be very difficult. And we are consistently working with we call it an Epic super user, who will refine, define, will make things just that much better.
Right.
So that our documentation is complete, it's good. We actually have the matrix in our note. And my wish list is that I could take the living matrix from the computerized living matrix and somehow figure out how to put the matrix into my note through Epic. That would be, and the timeline, those two things, which are automatic, would be perfect. So maybe that'll happen.
Right. So that's another good point. The documentation part of it becomes very efficient when you have all these templates already made, and just the time and energy to invest to make each of those. Then everything.
Because we're billing, remember, we're billing insurance. So I have to document. I have to make sure I'm hitting every single category and having enough information that the patient will be reimbursed, and making sure all the diagnoses are in there. And Epic has a lot of them. They even have brain fog. I love that one.
So, I mean, there's part of this patient encounter where it's just experience, and you probably wouldn't have the same outcome maybe when you first started your career as a physician with getting patient compliance as you do now, right? Would you agree?
I think so. I think, it's kind of like with everything, except, I have to just comment. When I did nutrition, I think I had the same patient evaluations. I don't think I changed all that much, other than I just feel like I've got a lot of information in this brain that I can share with patients and with people and whatnot. And I think I probably owe it to a lot of my original training when you first start learning how to talk to patients.
Right.
How to be kind, they talked about that in med school, like how do you teach someone empathy?
Right.
And I think there are some individuals that just have it innately, and I think patients know it.
Yeah. I can tell you, like, for example, when I used to teach seminars all over the country, like every weekend, and the great thing about that was meeting all these different people all over, and I got to learn so many lessons from them, and it was a great time of just meeting and learning from other people. But I remember there were different patterns of people I would see, and one would be a common pattern would be like, my patients won't listen to anything I say, they just won't comply. And I'm like, I don't think it's if every one of your patients won't comply, maybe it's not your patients. Maybe it's your approach. So as a medical director, and if you have other physicians and healthcare providers that are working in your center, what kind of advice and tips would you give to someone? Because a big part of compliance is that message getting across. So if you see patient to patient not having compliance, or if you were teaching and someone came up to you and said, hey, I can't get my patients to comply, what would be the red flags for you? What do you think could be happening in that encounter?
Yeah, I would look at a lot of times, and this has happened, where I want you to do this, like you have to do this, and the patient's not ready. They're not ready. That's number one. The other thing is giving the patient too many things. Like if you gave the patient 10 supplements all up front, and then they look at the bill, and then they're like, I can't do this. I can't do this. Or we've like so many of the things that we give, like herbs, have to be 20 minutes before you eat, 2 hours after you eat. I only eat twice a day. So you're giving it me 3 times. How do I fit this in? So a lot of streamlining, educating, and making it so that it's actually attainable, and have the patient like sit down with the patient and say, is this reasonable? Is this something that you can do? Instead of saying, this is what I want you to do, because we know what works.
Mhm.
But what's going to work is if the patient does it. So that's where meeting the patient where they're at. Even
Right.
with food and nutrition, like I may not have every patient go on the elimination diet every single time. Well, let's say if I wanted that, I may say, okay, let's just start with gluten, dairy, and sugar. Can you think you can do that? Yeah, I could do that. Versus someone else could do the whole, kit and caboodle. And then if the patient's not doing better, then I would say, okay, now we got to relook at this, because maybe there's other things that we need to work at. And I think I have a lot of patience with patients. And I think that makes a big difference too, because I have the ability to sit back and go, all right, well, let's just start all over, or the patient comes in and says, can I just start all over? I said, absolutely, let's just go for it. So it's, everyone's different. And I think you kind of know that yourself when you start seeing patients and what each one needs. And I don't do a cookie cutter approach to everyone. I don't do a cookie cutter lab testing for everyone. And I think that's the other thing, is I try to be very kind of minded and judicious in terms of what I'm going to order for that person, because of what I'm seeing as their clinical imbalances.
Right. And this is where the real skill comes in, that the not just evaluation, because, if you look at it, everything's going to be off at some point, because when people get chronic, they're going to have a gut issue, they're going to have, blood sugar imbalances, they're going to have some hormonal shifts. And I'm like, oh, that's going to be there. And then I think those that are new to functional medicine will go, well, I'm going to be good. I'm going to do everything at once. And you got to follow this protocol. Don't you want to get better? And then they push that on them, but instead of like kind of figuring out what's going on. And the attribute I see with really skilled practitioners is they can prioritize what's going to have the biggest effect downstream. Right? So they just kind of like, I'm really going to focus on this right now.
Absolutely.
And when I share my case studies with some of the practitioners, I hear the frustration back, like, why didn't you do this, and this? And it's like, I don't want to do 20 things at once. I want to pick the priority and kind of work through it. And the compliance is the other part. The diagnosis and workup is not even the real game. The real game is getting that message across and then getting that.
And mind you, being in an academic institution with people with limited budgets, we've even at times, let's say I ordered 5 supplements, I'll sometimes have to rank 1 through 5,
right,
which is the most important. And like, if you can only take one, this is the one I want you to take. And if you can take all of them, and find out like of those, making sure you're only on it for 2 months, because then some patients come back, and if a practitioner hadn't done that, a year later, they're taking everything and they're still taking it. And I'm like, okay, let's go through this. Let's update this. We don't need to be on all of these for that period of time. And I think that's important. Right. And I think we tried to spell out as clearly as possible. We have something called an after visit summary that the patient then takes home. There's step 1, 2, 3, 4, 5, what they need to do. A lot of times I will intervene with nutrition at that time if their insurance does not pay for nutrition, and I'll have to take over that part, or I then get them back into nutrition. Sometimes I'll have weekly health coaching visits, and we don't charge for that. So that's a wonderful thing for patients, because they're just loving having someone checking in. Are you walking? What's your movement? Like, what are you doing with your sleep? How can I help you? And then sometimes they'll like, oh, can you get Dr. Bradley to do this, this, and this? Or I have questions about this with the nutritionist. So they'll be sort of like the gatekeeper or the quarterback to also help us get the patient to where they need to go also.
Okay. So, yeah, I could see why you're able to accomplish so much with, in an academic medical center, because you're having forums, you're having templates, you're having these programs, follow-ups, you're having like these systems in place where everything can be done efficiently. And most people in private practice don't think about that. And most people that are doing functional medicine in an academic center or medical center are thinking they have to completely do things differently, but they can't make it work in that setting. They just have to follow.
But you know what? You could do this in private practice, and then your life is so much easier.
More efficient. Yeah, exactly. So what do you do with the situation where there is a variable that has to change for them to get better, and they're having difficulty doing it? Let me give you an example. Let's say you have a confirmed celiac disease patient, Okay. And the chronic inflammation and all these consequences from that chronic inflammation that are all their chief complaints. But it's really ultimately, they're inflamed, and it clearly it's celiac disease, and they're having a hard time with the gluten. And what are your
approach
clinical skills approach?
Yeah. The first thing is I love pulling up Fasano's picture from Scientific American, the slide where he shows the gluten and the cascade, the immune cascade.
Okay.
And I even tell patients it's on, I don't like to refer to Dr. Google, but it's on Google, or we give them a copy of it. I start with the education part and kind of explain to them, let me just share with you what's actually happening when you do have gluten, and this is happening in your body. And then, by the way, I would then talk about the cross reactivity with, if you have true celiac and you have the gene for it. We have another wonderful slide that shows all the different cross reactivity with other autoimmune disorders that the genes are shared. And I kind of go into that not as a scare tactic, but just as an example of, you may be born with this gene and now it's expressing itself because of certain things, that diet, for example, that is letting this come forth. But there are other things that it's going to help with downstream. And then from there, the best, I have to say, our nutritionists are so phenomenal. But I said, I know you may miss certain types of food, but they're not aware of other foods that they can eat as a replacement. And that's sort of like, okay, you've got it. It's my enthusiasm. You've got to check out this brand. This is so delicious. This is wonderful. And then my nutritionist could take what you love eating and put together a stylized nutrition plan that could be exactly just as fulfilling, and you won't even miss gluten. And they're like, really? So then let's say if I had someone with Hashimoto's and they have celiac, and we actually have shown, and you talk about normal lab testing, that we have seen the TPO, the antibody, come down with them avoiding a really strict diet. And then when they're not, it goes right back up. And so it's really interesting to show them that the impact that they can have on they are a partner in their whole disease process in terms of helping it. And I think that's important. Like they have a role. It's not just me telling them, you can eat all the gluten you want, but you know what's going to happen. And let me explain to you on a I guess more of a medical end on what's going to happen, so that you are aware, and that it's your choice. I go back to it's your choice. I can be dogmatic if I want to. You can never have this again, but if you do, this is what happens.
Right, but right away you went right into a diagram again.
Yes, I'm a visual learner. Okay, that's
right,
me.
But I think that's what makes you so effective with your patients and your appointments and how they get it.
And I engage them right away.
Right.
But they pull up their chair. And mind you, we've got the cat's meow. I have 2 screens in my examining room.
Mm-hmm.
And we have a table here, and the patient has the seat here. So they could be looking at this huge screen. I have my EMR on one side. And so they could see this and it's used for education. It's wonderful. And that's the other part that I think is really effective. Is that, and I have all of these, like at a moment's click, I can just pull them up.
Right. So a big part of your consultation with them is really to have them connect and get it, and education. And that's kind of where you start, right? And then, then you can kind of look at their body language and kind of see if they're getting it. And then if they're not getting it, you keep moving until they get it. And then
I just meet them where they're at. Because I've had some people that the arms are like this.
Right.
And they're like, I don't think any of this works. I don't believe any of this. I'm like, okay. So now I was like really digging deep and trying to figure out, let me try to explain to you how it does work.
Right.
And you may not be aware of it because it's a whole new world. And we have this whole world of functional medicine is fairly new in terms of the word functional medicine, but it's been around for a long time.
Right.
And I think that's part of also, if a patient is not aware of the impact that what they're eating or whatever the lifestyle that they're having on their body, once you show them the impact, I think that's when I start seeing their behavior change also.
Right. And if you didn't have all these questionnaires and documents and forms and learning tools and aids, what would happen to your schedule and time, do you think?
So it's funny you said that, because sometimes not every patient does all the forms and fills them, and they're like a blank slate in front of me. And we've almost laughed in the group because we said sometimes that's easier.
Mm.
Because the one thing I would just say to the patients, so tell me, what are we going to do today? How can I help you? And I just started that. What are your top three? Kind of like what I did, even though I had the living matrix, but I have so much more information about them that I could bring into the appointment. But now I don't have anything. And then all of a sudden, it makes me really focus in on everything that they're saying for that moment, as far as what's the most important thing to them, without me bringing in all the other components that I already know. So my brain gets a little clearer, to tell you the truth. I know it sounds odd that I would have, it would be easier, but it's also because I don't have as much information.
But if every visit was like that, what do you think would happen?
Oh, well, if in this setting I am right now,
Yeah, where there's no tools.
no tools at all. Yeah, it would be frustrating for
Very
me.
frustrating.
Yeah, I would make them. You know what I do? I draw.
Yeah, we have a lot of practitioners that have little whiteboards and they draw everything
Yeah,
out.
yeah.
We have some that have lots of educational images like you do, which make it very effective. And then some have like videos of the same, like here's how you do an elimination diet. You say you stay blood sugar.
Right.
And then those tools all make all
But
the
one thing to let you know, and we know this from patients, we have sent out, even pre-video things for them to do prior to the visit. Most of, or a lot of people don't have the time and they don't do it.
That's true. Yeah, that's very true. That's a good point.
Yeah.
So I always end our interviews with, we have, we need your input on this. We have two different groups that are learning functional medicine, some that are new and some that are really advanced, been doing this forever. And what advice would you give those that are new? And what advice would you give those that, are really highly skilled functional medicine practitioners?
Sure. If you're new, I would listen to every podcast. I would read as many books as you can of all the great people that have gone before you, because that's where your basis of knowledge really comes in. And then take one patient at a time and go slow with it, and don't force. We call it the layers of the onion. Go slowly, keep layering, going deeper and deeper with each patient, but starting with the basics and then go deeper. And then for someone who's really highly experienced, I don't know if I could tell them anything other than with the functional medicine world, I would say talk to every colleague and spread the word about functional medicine, because we have to keep the momentum going. And if you're that highly experienced, bring people into your office. Be that mentor. Be the person who can help others. Because I'm finding you can get trained and certified in functional medicine, but it's really hard to practice it. And so we need more and more mentors out there who are willing to be part of the kind of the movement going forward.
Nice. Well, thank you so much for your time, and thank you for everything you're doing.
Wonderful.
The whole community is, so appreciative of you making the center so successful, and really helps all of us out, and really helps the profession out, helps the specialty out. And so thank you for that.
It was a joy. Thank you so much. All right. Take care.